Dear students, this is our first pre-lab in the module of special sense, and this is our first anatomy lab. This is the anatomy, it will be the anatomy of the skull. Today we're gonna describe the anatomy of the skull, and then later on, maybe in a week, you will attend a practical lab where you can hold the skull with your hand and you can identify all the features that we're gonna describe today. It's essential to bring your logbook, practical logbook, with you to follow the checklist and identify all the items. In the lab, you will sit as a group, small group. You have to identify all the features in the checklist by your own, by the help of your friend as a group, and then the anatomy instructor will be there. They will come to you, they will ask you about the parts that you have to identify. They would like to be sure that everything is okay, that you identified all the parts in a proper manner, and you also sure you are allowed to ask anything to the instructor. They have to clarify anything to you. So let's start. As usual, we're going to describe in English and in Arabic because we have our colleagues from different countries. They are more than welcome here. So let's start by describing the skull. As you see, the skull, it's very hard to describe. It has so many features and so many aspects to see. So from where I would like to start, we have to describe the anatomy of the skull by the aspects. So, for example, I'm looking forward, so this is the norma frontalis. I will describe the norma frontalis. If I'm looking to the vault of the skull, superior view, superior aspect, this is called norma verticalis. Okay? And if you look to the skull, lateral view, this is called norma lateralis. Posteriorly, this is norma occipitalis. So till now, we have norma occipitalis, norma verticalis if I'm looking from upward, norma lateralis if I'm looking from the sides or looking to the sides, and norma frontalis, I'm looking to the front of the skull. What else? We can also see that this is the base of the skull. So this is called norma basalis, the base of the skull. The base of the skull could be seen from outside, or if I remove the cap, I can look at it from inside. So we have two norma regarding the base. Norma basalis interna, if I'm looking to the inside of the skull, and norma basalis externa. This is from outside. So let's start our description. تمام يا جماعة؟ يبقى احنا دلوقتي كده السكال زي ما احنا شايفينها بون كتير قوي مع بعض مجتمعين عاملين السكال. طب انا اوصفها ازاي؟ هوصفها according للفيو اللي انا ببص عليه. تمام؟ يبقى لو بصيت من قدام نورما فرونتاليس، نورما فيرتيكاليس، نورما لاتراليس، اوكي؟ نورما اوكسيبيتاليس لو انا ببص عليها من ورا، والبيز عندي يا اما هشوفه من بره يبقى نورما بيزاليس اكسترنا، يا اما هبص عليه من جوه ويبقى ده نورما بيزاليس انترنا. تمام؟ طيب يلا let's start. We'll start by describing the norma verticalis. We'll look to the superior part of the skull. We can see here three bones. This one looking anteriorly and two other bones. This is the frontal bone, and these two are parietal bones. So I can identify here one bone, single bone, frontal bone, pair bone, parietal bone, and posteriorly you can also see part of the occipital bone. This is the vertex norma verticalis. Okay. Those are the bones that should be identified. Let's see here another model of the skull in color. Okay, let's see like this. Okay. Frontal bone, parietal bone, occipital bone. Those are the bones present here. Okay, let's see what are the features present here. I can identify sutures. You can see the sutures, right? Okay. This suture, this one, you can see that it's going with the coronal plane. As if I'm taking coronal section. That's why it is called coronal suture. Coronal suture. And this one in the midline between the two parietal bones is called sagittal suture because it lies in the midline, as if I'm taking a sagittal section. Coronal suture, sagittal suture. Okay, what about this one? There is another suture here. This suture is called, it's forming an angle, if you see, okay, like forming like a pyramid, like this. This is called lambdoid suture. Lambdoid suture. Let's say again the sutures. Coronal. This is coronal. This is sagittal. And this one is lambdoid suture. The coronal suture is separating the frontal bone from the two parietal bones. The sagittal suture is separating the two parietal bones. The lambdoid suture is separating the two parietal bones from the occipital bone. And remember that the suture here, we know that the suture is a kind of the fibrous joint, one kind of the fibrous joints. Okay, let's go for further description. The point of meeting of the coronal suture with the sagittal suture here, this point, the point of meeting here, is called bregma. Bregma. And the point of meeting of the sagittal suture with the lambdoid suture here, this point is called lambda. L-A-M-B-D-A. Lambda. Okay? These are the points of meeting of the sutures. Notice the following. The lambda here, which is, the bregma here, which is the point of meeting of the coronal with the sagittal suture. In the newborn, it's not just a point of meeting. It is not ossified like this. It's an area. There is no bone in this part, forming a fontanelle, forming what we call a fontanelle. And because it's present anteriorly, so it is the anterior fontanelle. So the newborn, if you check the skull of a newborn, you will find a space here. There is no bone. It's just covered by membrane. It is not ossified yet. And we call this anterior fontanelle. The anterior fontanelle in the newborn is about 3 fingers width. And it is closed to form the bregma at 1.5 years. If it lasts more than this, this is a sign of delaying of the growth of the bone. Okay, let's go to see the posterior one. This is the lambda. The lambda represent the posterior fontanelle in the newborn. If you check, if you examine the head of the newborn, you will find a space here like the anterior fontanelle, which is not ossified. It's only closed by membrane. It is not ossified yet. And we call this the posterior fontanelle. So we have here the anterior fontanelle in the newborn, and here the posterior fontanelle. The posterior fontanelle should be closed by 3 months of age. Okay? Do you think you have now fontanelle? No, all of us now don't have fontanelle. We only have the bregma and the lambda. Okay, let's continue to see the rest of the features in the norma verticalis. Along the sagittal suture, you have to identify openings, small openings. You can see here, those are called parietal foramina. Parietal foramina. They could be 2, 3, they could be on one side or on both sides, doesn't matter. But if you find an opening, small opening along the sagittal suture in the parietal bone, they are called parietal foramen. What else do we have? I can notice here a prominence. شايفين الحتتين بارزين دول؟ Okay, can you see this? These eminence are called parietal eminence. Parietal eminence. Okay. Now let's see the norma frontalis. But let's explain the norma frontalis in the next video.